Welkin empowers health organizations to deliver patient-centered care. Welkin is purpose-built specifically for healthcare organizations. Some key differences you'll see from other tools used for patient management are configurability, patient centricity, extensibility, and workflow automation that enables more human caregiving. In this video, we'll focus on Welkin's care delivery portal, where the care team would spend their time. At our cardiology center, one of our main goals in working with patients is to reduce the occurrence of hypertension and thereby reduce the risk of heart disease by helping patients to make positive lifestyle changes. We coordinate across a care team to provide seamless patient care from the time a patient first comes into our clinic throughout their entire journey. When Charlie, who is a care coordinator at our clinic, logs in, he lands in his inbox, which is a collection of personalized tasks he needs to complete today. These tasks keep him focused on what he needs to do for our patients, whether he's assigned them for himself or they've come from our team or automation rules and triggers, such as patients missing appointments. These tasks are grouped by categories that are unique to our program, patients, and the type of care we need to deliver. The inbox categories and additional information that is displayed were configured by Nassim, our program director, so that Charlie has an at-a-glance summary that helps him understand what he needs to accomplish. Charlie has an alert that Pablo, one of our patients, recently missed an appointment. When Charlie clicks on Pablo's name, he is taken to Pablo's patient profile. All the members of our team, MAs, care coordinators, and our medical director that engage with Pablo are centered around this profile. It contains information from systems that are integrated with Welkin, like an EHR or a blood pressure monitoring app, assessments the patient fills out, inputted information from other people, and a full history of our interactions with Pablo. It also contains prompts which guide Charlie through his work, such as the missed appointment prompt above Pablo's timeline. Charlie can see that Pablo is more responsive to scheduling via text, so he reaches out using an SMS template to reschedule Pablo's last appointment with Mason. After their text conversation, Charlie creates a scheduled appointment for Mason that Mason gets an email notification for. Several days later, when it's time for Pablo's appointment, Mason sees the appointment in his inbox. He clicks to navigate to Pablo's profile, where he can see Charlie's latest interactions with Pablo and any other history that is relevant for his role. Pablo has been engaged in our program for several months. Mason can view reporting for Pablo and see that his blood pressure hasn't improved significantly. When he initiates the call for their scheduled appointment, his prompt changes automatically to guide him through all of the necessary steps. This was a template created in Workshop, our no-code required program editor, which we'll cover in another video, and includes the information Mason needs to remember for this type of appointment. On the call, Mason and Pablo fill out a health risk assessment together. Based on Pablo's responses, a risk score is calculated for him, and he is automatically designated as a high-risk patient. Based on this new designation, his patient phase is updated and an alert is triggered for members of his care team so they will be able to adjust their care for Pablo. A high-risk care plan is also added to Pablo's profile that coordinates interventions for Pablo across the care team. When one of these interventions is due, Mason, Charlie, or another appropriate care team member will see a notification in their inbox to take action. When Pablo's call is finished, Mason can disposition the visit to indicate it was completed and select the appropriate billing code. This code is then used to automatically generate a claim for the visit through an integration with Welkin. One of Mason's tasks for Pablo is to aid with weight reduction. Mason refers Pablo to a nutrition center and adds this nutrition center to Pablo's profile. He then creates a task for Charlie to follow up with Pablo to help him schedule a consult with this nutrition center and to answer any questions Pablo might have. In this relationships view, Mason and Charlie can also see anyone outside of our clinic's care team that is invested in Pablo's care and with whom our care team may need to coordinate. A final step that has been automated in Workshop is to send out an appointment follow-up survey so that Pablo can provide feedback on his most recent experience to help us improve our care. Once Pablo fills the survey out, the care team will get a notification in their inbox to review the assessment, and the responses will show up on Pablo's profile. As our care team continues working with our various patients, Mita, our medical director, can review the efficacy of our care and caseload management using Welkin's dashboards. They can see patients within each phase of care, the progress of patients' various health assessment scores over their patient journey, and drop-offs in patient engagement. Our team can also export the data we need to provide required metrics back to government and regulatory agencies. The customized patient profile, automated workflows, and my personalized inbox were created once by our program director in workshop, but they can be reused across the entire care team. As we continue to learn what works best for patients in our programs, we can give that feedback to the program director, and they can use built-in analytics to easily iterate and roll out updates. Over time, we know this will empower us to deliver the best patient experiences and highest standard of care.